Robert F. Kennedy Jr. has given his first network television interview since becoming health secretary to our Dr. Jon LaPook.
They talked about, among other things, the impact of cutting thousands of jobs at federal health agencies and the high cost of some of the most popular prescription drugs.
None of them have any ingredients that you can't read.
We joined the secretary at a Native American food program near Phoenix and asked him about the Trump administration's decision last week to cancel expanded coverage plans for popular weight loss drugs such as Wegovy. They're known collectively as GLP-1s.
GLP agonists, which are extraordinary drugs,
aren't they?
Are available to anybody who's got diabetes.
But obesity.
We're looking at a regulatory framework for making it available to people under insurance. It will be available to anybody who wants to pay for it. We are reducing the cost. We're going to reduce the cost.
Will Medicaid and Medicare cover it?
Well, they won't. Let me finish in telling you what our kind of blueprint is. Ideally, over the long term, we'd like to see that those drugs available for people after they try other interventions. And if they don't work, then you would be entitled to the drug.
So if that doesn't work and a caregiver, a health care provider says, you know what, give it a good try, Medicare and Medicaid will cover the GLP-1.
That is the framework that we're now debating.
Part of the debate includes figuring out where to make cuts to save money.
You propose more than $11 billion in cuts to local and state programs addressing things like infectious disease, mental health, addiction, and childhood vaccination. Did you personally approve those cuts?
No, I'm not familiar with those cuts. We'd have to go. We'd have to go.
There's like more than 50 pages of cuts that I actually went through.
The cuts were mainly DEI cuts, which the president.
There were a lot, but I'll give you, for example, about $750,000 of a University of Michigan grant into adolescent diabetes was cut. Did you know that?
I didn't know that, and that's something that we'll look at.
Dr. Jon LaPook joins us now. Arguably, John, the biggest thing that's happened at HHS are these cuts, and he seemed vague about what was going on beneath him.
Yeah, I had the sense talking to him that these were mainly DOGE cuts. And that raises the question, what are the specific criteria for defining waste, fraud, and abuse? And on the one hand, you have Secretary Kennedy who's saying one of the most important criteria, important goals for him is to deal with adolescent child diabetes, right? Then I went down the list, by the way, more than 50 pages, very small font of like the cuts that were made and grants and things like that. And I found from the University of Michigan at Ann Arbor a $750,000 grant for researching adolescent diabetes. So, you have to say, like, okay, who is making these decisions at DOGE? Are they trained in science? Do they have enough knowledge to be able to look at these? Because it's basic science stuff. They may not even be able to understand what the research is. So it raises a lot of questions. I mean, I have to say, though, in terms of the going back and forth with him, I was really impressed with the tone of voice, the civility, and the fact that we had a respectful conversation. They gave us a lot of time.
All right. Thank you, Doctor. We should also point out the rest of your interview, where you can be found at cbsnews.com. Appreciate it.